Okay, everyone. So for today, we will be tackling the neuromuscular junction blocking agents. So for this report, we will be mentioning the brief description, the mechanism of action, the indications, and the pharmacokinetics, the side effects, the drug interactions, the contraindications, and the nursing considerations. For additional to our report, we will be tackling or mentioning the summary of the classification of drugs under the central nervous system. For the brief description, it will be mentioned by Ms. Queen, and later on, for the mechanism of action and indication, it will be reported by Ms. Diane.
Neuromuscular junction blocking agents. So what is neuromuscular junction blocking agents? Drugs that interrupt transmission of nerve impulses at the skeletal neuromuscular junction. They can be of two types: competitive stabilizing blockers or neuromuscular non-depolarizing agents, and the non-competitive depolarizing agents or neuromuscular depolarizing agents. Both prevent acetylcholine from triggering the muscle contraction, and they are used as anesthesia and adjuvants as relaxants during electroshock in convulsive status or etc. And neuromuscular blocking drugs or NMDBs prevent nerve transmission in skeletal and smooth muscles, leading to paralysis. They are often used as adjuncts with general anesthetics or surgical procedures. Neuromuscular blocking drugs are also paralyze the skeletal muscles required for breathing, the intercostal muscle and the diaphragm. The patient is rendered unable to breathe on his or her own, and mechanical ventilation is required to prevent brain damage or death by suffocation.
So for the mechanism of action of non-depolarizing neuromuscular blockers, these are competitive acetylcholine antagonists that bind directly to nicotinic receptor on the postsynaptic membrane, thus blocking the binding of acetylcholine so the motor end plate cannot be depolarized. For the indications, this serves as an adjunct to general anesthetics during surgery when reflex muscle movement could interfere with the surgical procedure or the delivery of gas anesthesia. Next is facilitate mechanical intubation by preventing resistance to passing of endotracheal tube and in situations in which patient fight or resist the respirator. Facilitate various endoscopic diagnostic procedures when reflex muscle reaction could interfere with the procedure. Next is the facilitate electroconvulsive therapy when intense skeletal muscle contractions as a result of electric shock could cause the patient broken bones or other injuries. Mechanism of action of depolarizing neuromuscular junction blocker. They produce their block by binding to and activating the acetylcholine receptor, at first causing muscle contraction, then paralysis. They bind to the receptor and cause depolarization by opening channels just like the acetylcholine does. For the indications of depolarizing neuromuscular junction blocker, these are commonly used to paralyze patients requiring intubation, whether in an emergency as a life-saving intervention or as in scheduled surgery and procedures.
For the pharmacokinetics, this involves the absorption, distribution, metabolism, and the excretion of the certain drug. So this will be reported by Ms. Favor.
Okay, so on to the pharmacokinetics. We have the non-depolarizing neuromuscular junction blockers. And first of all, it is absorbed through the injection, through an IV injection, and has an onset of action of within 4 to 6 minutes. The duration effect is in 120 to 180 minutes, and it is distributed through a non-depolarizing NMJ blockers and are hydrophobic instead of lipophilic, so they do not readily cross the blood barrier and have little effect on the ACH receptors in the insulin. Then we have the metabolism. It is metabolized by the tissues and not by the acetylcholinesterase, and it is excreted through urine. Then for the depolarizing neuromuscular junction blockers, it's absorbed through injection, through an IV injection, and the onset of action is within 1 minute, and the duration effect is 10 to 12 minutes. And it is distributed through succinylcholine crosses. When succinylcholine crosses the placenta, and effects on the lactations are not known. Then it is metabolized by the tissues and not by the acetylcholinesterase, and it is excreted through urine.
This side effect is regarded as an undesirable secondary effect which occurs in addition to the desired therapeutic effect of a drug or medication.
Okay, so we're going to discuss the side effects of neuromuscular junction blocking agents. So first, in cardiovascular, it increase or decrease of blood pressure and heart rate, and also it can produce negative chronotropic and entropic effects, and it also increase heart rate and contractility and alleviate circulating catecholamine levels. So for children is bradycardia, and for adult is arrhythmia and bradycardia. And for the fasciculation is the long twitching of muscles. For the hyperkalemia is high potassium. Side effects of non-depolarizing aminosteroids, tachycardia and bradycardia, hypertension and hypotension, bronchodilation and bronchospasm, and hemodynamic instability, benzodiazepines, seizures associated with neurotoxic metabolite, lodanosine, hypotension, or histamine release. Depolarizing side effects, bradycardia, malignant hyperthemia, and hyperkalemia.
Any condition that is related to a disease state or including current, recent, and drug therapy that renders a particular form of treatment improper or undesirable is called contraindications.
Okay, so next we have here the contraindications and cautions for the NMJ blockers. So this is both for the non-depolarizing and depolarizing NMJ blockers. Okay, so first one we have here so NMJ blockers are contraindicated to patients who are allergic to NMJ blockers. So this is to prevent hypersensitivity reactions. So it is not advised for them to use it. Next, we have here the myasthenia gravis. Okay, so NMJ blockers are contraindicated or not advised to patients with this disease because it aggravates by blocking the ACH cholinergic receptors. Next, we have here the renal and hepatic disease. This is not advised to patients with this disease because it interferes with metabolism or excretion of drugs, leading to toxic effects. Okay, so next we have here the family or personal history of malignant hypothermia or hyperthermia, Okay, so the characteristics include extreme muscle rigidity, severe fear, acidosis, and death. So it can occur with the use of NMJ blockers. Okay, so next it is also contraindicated to patients with pulmonary and cardiovascular diseases because it exacerbates by paralysis of respiratory muscles and resulting to changes in perfusion and respiratory function. Okay, so next, it is also contraindicated to patients with altered fluid and electrolyte imbalance. So this can affect membrane stability and subsequent muscular function. Lastly, we have here the lactation. So NMJ blockers are contraindicated to patients who are lactating or breastfeeding because of potential adverse effects to the baby. Okay.
So for the drug interaction, many drugs interact with NMBDs. NMBDs are commonly used in the OR to assist with tracheal intubation and improve surgical exposure and ensure immobility during surgery, which may lead to either synergistic or opposing effects. So here are the additive effect of NMBDs. First is the aminoglycosides, calcium channel blockers, clindamycin, cyclophosphamide, cyclosporine, dantrolene, furosemide, inhalation anesthetics, magnesium, polymyxin, procainamide, and the quinidine. They are the drugs that interact with neuromuscular blocking drugs.
Okay, for nursing considerations, the first one is whenever general anesthesia is used, the prescriber's recommendation orders about whether any medication should be disconnected or tapered before anesthetic administration should be emphasized. So always emphasize what is administered. And then, second is make sure that information about the anesthetic, route for administration, adverse effects, and special precautions is included in pre-procedure and surgical educations. And then the third is, so all fears and anxieties about anesthesia and related procedures, surgery should be discussed openly. So educating the client on drug therapy will promote understanding and compliance. Okay, so the fourth one is share with the patient and family instructions about the post-anesthesia process and the need for close monitoring of vital signs, breath sounds, and neurologic intactness. So patients should expect frequent turning, coughing, and deep breathing to prevent atelectasis or pneumonia. And then the fifth one is, so the fifth is the patient should be encouraged to request pain medication if needed before pain becomes moderate to severe. So the patient should be informed that even though anesthesia has been administered, there may be still be discomfort of pain from the procedure or surgery. So the anesthesia will wear off and adequate analgesia needed. The patient should be asked to rate his or her pain on a scale of 0 to 10. So with 0 being no pain and 10 being the worst possible pain. And for the sixth one, is to encourage patients to ambulate with assistance as needed and as ordered. So mobility helps increase circulation and improve ventilation to the alveoli of the lungs. So consequently, circulation to the legs will be improved, which helps to prevent stasis of blood and possible blood clot formation in the leg veins. So assistance is needed to prevent falls or injury until recovery from anesthetic.
Next, for the patient who has diminished sensorium is the general changes in brain function like confusion, loss of alertness, disorientation, unusual or strange behavior, regulation of emotions, and disturbances in perception, psychomotor skills, and behavior. Their safety is our #1 priority. Make sure to put the bedside rails up and call button at the bedside. Everyone involved in the post-anesthesia and post-surgical care, such as the family, should be educated about the safety measures. Next, with the local anesthesia, the patient should understand in the purpose and the actions of this local anesthetic as well as their adverse effects. Patients receiving the NMBLs or the neuromuscular junction blocking agents should know they may not be able to move due to paralyzing effect. That is why we nurses should inform and educate them thoroughly with the side effects that may occur while taking the drug, because being in this condition is extremely thinning even with the extreme patient education. Lastly, for the patient who's receiving spinal anesthesia, they should be informed for the need of frequent and system assessments, measurement of vital signs during and after the procedure for the reason that to monitor the complications that may occur.
Lastly, we have here the drugs under CNS. So since this was already discussed by Ma'am Sherlyn, we're just going to have a rundown of the classifications and subclasses under these drugs. Okay, so first one, we have here the anxiolytic and hypnotic agents. So under these agents are the benzodiazepines or the benzos and barbiturates or barbs. Okay, so an example of benzos are the alprazolam, and you can check the module uploaded by Ma'am Sherlyn on Canvas for other drugs. And next, for the barbs or barbiturates, an example would be phenobarbital. So you can also check for the module. Okay, so next we have here the antidepressant agents. Under these agents are the tricyclic antidepressants, monoamine oxidase inhibitors, and the selective serotonin reuptake inhibitors. Next, we have here the psychotherapeutic agents. Under this classification are the antipsychotic or the neuroleptic drugs, the anti-manic drugs, and the central nervous system stimulants or the CNS stimulants. Seizure agents, So, under this classification, we have also, again, the barbiturates and barbiturate-like drugs, the benzodiazepines or the benzos, and lastly, the succinamides. And next, we have here the anti-Parkinsonism agents. Under these classifications are the dopaminergic agents, the anticholinergic agents, and the adjunctive agents. Okay, so you can read on the module. There are examples there for these subclasses. Okay, so that would be all. Thank you for listening and God bless. Have a nice day.